Hello everyone. Today I felt like talking a little more about the pancreas, another extremely important organ that often only gets talked about when something goes wrong, and never gets praised when it's doing everything right. What do you mean I'm projecting? No, you're projecting. Anyway, I figured I'd make a piece inspired by the pancreas to do my part and help right this wrong. I decided to experiment with a background design that was inspired by some more classical optical illusions, and I ended up really liking the final result, so definitely be sure to check out the final product. I think the final video captures the illusion pretty well, but in person I think it's even better and really adds a 3D effect too, whenever you move towards or away from the picture. This design fell somewhere in between the thyroid design and the others, in that it was more geometric and required a bit more precision with angles and spacing, but was still simpler and less reliant on measurements than the thyroid was. I think the most important part was making sure the angles aligned, and the curves were wider in the middle versus the edges. Let me know what you think about how it turns out. So, what does the pancreas even do? The pancreas is a gland, or a tissue that produces bioactive compounds as its primary function. Typically, glands are either endocrine glands, meaning they secrete something like hormones directly into the bloodstream, like the thyroid, or exocrine glands, meaning they secrete something outside of the bloodstream, like salivary glands. When it comes to the pancreas, it actually has both endocrine and exocrine functions. Endocrine functions of the pancreas primarily serve to regulate blood sugar, which it does with insulin and glucagon. Insulin stimulates sugar uptake into cells for energy when glucose is high, while glucagon serves the complementary function, sending signals that break down stored energy and raise blood sugar levels when it's low. This is pretty easy to remember because you use glucagon when the glucose in the blood is gone. Together, these molecules help maintain a steady supply of energy for cells in the bloodstream, allowing us to eat meals and take breaks like sleeping, instead of requiring a small continuous supply of food to stay alive throughout the day. The exocrine functions of the pancreas primarily help with digestion. The pancreas attaches to the intestines with a small duct that releases digestive molecules that help break up food. These include proteases like chymotrypsinogen and trypsinogen that help break apart bonds in proteins, pancreatic lipase, which helps break apart fats, and amylase, which helps break apart sugars. The pancreas also releases a few other digestive enzymes that we won't get into here. The pancreas also aids in digestion by releasing bicarbonate and water, which helps neutralize stomach acid as it goes into the intestine, and is a necessary step for the enzymes it releases to function correctly. Acute pancreatitis, or inflammation of the pancreas, is extremely common, affecting between 5 and 80 people in every 100,000 per year, and it is the most common gastrointestinal-related cause of hospitalization in the United States. The most common causes include having gallstones that block the common bile duct, which connects to the intestines, chronic alcohol use, and having high triglycerides, while less common causes can include genetic malformations, infections, or side effects of medical treatments, like injury during surgery or medication side effects. A mnemonic I learned in medical school to remember all these causes was bad hits. B for biliary, meaning gallstones, A for alcohol, D for drugs, H for hyperlipidemia, I for idiopathic, meaning unknown, T for tumor or trauma, and S for scorpion stings. Another commonly used mnemonic is I get smashed, but I prefer a simpler and shorter mnemonic, and bad hits is the one I was taught in medical school, although my surgery attending preferred to rearrange the letters in hits to spell something else. Pancreatitis is diagnosed based on the presence of mid-upper abdominal pain, elevated pancreatic lipase or amylase levels, and with imaging. Most of the time patients come in with sudden pain just beneath their sternum that may get worse with eating, and they may also feel nauseous. there is a pretty big differential for this constellation of symptoms, so they will likely get worked up for several things at once, including possible heart attack and gallbladder problems. But the testing for pancreatitis with imaging and labs works quite well, so it's very unlikely to get missed as long as the appropriate workup is performed. Severity of pancreatitis can range significantly, from minor to potentially fatal, but most of the time people recover without complications, with a mortality rate of about 5%. The mainstays of treatment are fluid resuscitation, pain control, and early feeding, and rarely treatment with antibiotics if there is a concern for infection as well. Some surgical measures can also be taken if a stone blocking the duct is the primary cause, but otherwise surgical intervention is quite rare. Chronic pancreatitis is pancreatitis that occurs much more slowly, gradually leading to destruction of cells and scarring that results in decreased endocrine and exocrine function of the pancreas. The most common cause is alcohol use in adults, although genetic factors like cystic fibrosis can also cause chronic pancreatitis in children. Chronic pancreatitis usually presents like multiple, usually smaller, episodes of acute pancreatitis, although in rare cases it can be painless. As more of the pancreas is destroyed, eventually other symptoms will develop related to malabsorption, such as steatorrhea, meaning diarrhea caused by inability to absorb fats, and deficiencies in fat-soluble vitamins. Diabetes can also develop. Diagnosis is very similar to acute pancreatitis with amylase and lipase levels and imaging, although some additional stool tests can also be done to test for deficiencies in other substances produced by the pancreas or stool fat levels. At least incidentally, I feel like a CT of the abdomen is where I see chronic pancreatitis come up most, as findings like calcium deposits, atrophy, and/or cysts are very characteristic and easily spotted by a radiologist. Further detailed workup can be pursued for indeterminate cases, but most of the time that isn't necessary. Treatment of chronic pancreatitis involves treatment of the underlying cause like alcohol cessation, treatment of concurrent depression if present, which it often is, as well as replacement of what the pancreas can no longer produce, like insulin, pancreatic enzymes, and vitamin supplementation. It may also be advisable to go on a low-fat diet due to poor fat absorption. Some additional treatments are also available depending on the specific cause of pancreatitis, and some surgical options exist if there are anatomic problems like duct blockage, obstructing cysts, or removal of parts of the pancreas. Complications of chronic pancreatitis can include chronic pain, weight loss, cancer, and diabetes and malabsorption, as already mentioned. In the busy, exciting, and debatably abusive world of surgery, there are a few key rules to abide by. 1. Eat when you can. 2. Sleep when you can. And 3. Don't mess with the pancreas. The pancreas is a temperamental organ that definitely prefers to be left alone, and touching the pancreas at all during most surgeries is begging for disaster. All kinds of terrible complications can occur as a result, and often attempting to fix the pancreas only ends up making it worse. There are a few brave souls out there who operate specifically on the pancreas, but often these are really only in cases of absolute necessity, and contact is minimalized as much as possible. As a matter of fact, this rule is so important that when brave transplant teams like the one at UTMB in Texas perform pancreas transplants, they literally cut out parts of the surrounding spleen and duodenum, or part of the intestine, to use as handles so that the pancreas can be removed without being touched. As you can imagine, this is not a surgery for the faint of heart, and certainly not one available to most patients. One of the reasons a surgeon might end up operating on the pancreas could be pancreatic cancer. Pancreatic cancer is a horrible disease, with a 5-year survival rate of 11% for all stages combined. If the disease is only local, 5-year survival can be as high as 44%, and if the disease is metastatic, meaning it has spread to other parts of the body, then survival is about 3%. The lifetime risk of pancreatic cancer is a little less than 2%. Non-modifiable risk factors include genetics and multiple cancer syndromes, while modifiable risk factors include smoking, obesity, and heavy alcohol use. Routine screening is not performed due to rarity, and there is some crossover in the workup of pancreatitis, but other additional testing is also necessary. Although surgery may be pursued in about 20% of patients, treatment is mostly medical or with radiotherapy. Perhaps one of the most notable cases of pancreatic cancer was that of Steve Jobs, who was diagnosed early, but then delayed conventional medical treatment while he pursued alternative therapies like dietary supplements and acupuncture for 9 months first. There are 2 types of diabetes, type 1 and type 2, and they differ greatly, to the extent that some have even argued they should have different names altogether. Type 2 diabetes is caused by insulin resistance, not by the pancreas itself, so I won't discuss that here, whereas type 1 diabetes is caused by failure of insulin production, which is directly related to the pancreas. Type 1 diabetes is caused when the cells that produce insulin die, and is almost always caused by autoimmunity, meaning when your own immune cells target the healthy cells in the pancreas inappropriately. It is most often diagnosed in childhood or young adulthood, but can rarely be diagnosed later as well. As insulin controls the ability of cells to uptake sugar and use energy, failure to do this usually means that type 1 diabetes diagnosis is typically done for the first time in an emergency room. Symptoms of hypoglycemia or low sugar may include feeling tired, generally unwell, inability to think or speak clearly, sweating, twitching, feeling like you might pass out, or even seizures. Before a new diagnosis, patients may also have unexplained weight loss, find that they need to pee frequently, and they may have voracious appetites. The name diabetes mellitus itself actually references the fact that in ancient Greece, diagnosis could be made due to the sweet taste and smell of urine, because all the extra sugar that wasn't being taken up into cells was being excreted instead. With insulin supplementation, a healthy lifestyle, and regular blood glucose monitoring, people with type 1 diabetes can live long and healthy lives. Synthetic insulin is produced by taking the same gene that encodes for insulin production in humans and inserting it into bacteria, causing them to grow and produce insulin themselves that is in every way identical to human insulin, which can then be harvested. There are other different types of insulin as well that can be synthesized and used, but as a former microbiologist, I just happen to find that the most interesting one to talk about. The cost of insulin is often a hot topic in healthcare, and unfortunately this still continues to be an issue in the US due to poor competition, pharmaceutical monopolies, and lack of meaningful government intervention. Well, here's the final result. Let me know what you think in the comments down below. I'm super satisfied with how it turned out overall. I think the optical illusion effect is fun, and I had a good time working on it. I enjoyed being able to review more about the pancreas, and hopefully you were able to learn a thing or two along the way as well. One of the primary sources I use as a reference is the AAFP, or American Academy of Family Physicians website, and they have a lot of really useful, patient-friendly information as well, and I would really encourage looking there for any medical questions you might have, especially considering how authoritative government websites are no longer reliable sources of scientifically accurate medical guidelines and information. Stay safe out there, and remember, don't mess with the pancreas.